Hi, I'm Dr. Tamer Seckin. We are here in Osaka. I have a very important guest with me whose respect and admiration I had for many years as a medical student back in Turkey. I have bought a series of books that he has edited. It was probably 13 volumes or 12 volumes about gynecology and obstetrics. I have Dr. Professor Sciarra from Chicago, who is a member of our ISGE board now, and who is well known all around the world for his work to the profession that he has given so much of his life fully. And we like to use some of his experience for our members. Maybe he has some messages as young doctors they are all over the world, as young surgeons. He must share some of his highlights in his life for future. Dr. Sciarra, welcome.
Thank you. One of the things that's really important in terms of laparoscopic surgery is that the skills that are necessary to do safe and effective laparoscopic surgery are really quite different from those skills that are useful in general obstetrics and in general surgery. And because of this, we have tried to develop new methods for teaching endoscopic surgery to residents and to fellows. And it's been a slow evolutionary development because many places do not have the capabilities of providing animal operating rooms, providing the didactic teaching necessary to develop skills for endoscopic surgery. One of the things that I like to stress in terms of developing skills for endoscopic surgery is that there are certain steps. One starts as a novice, moves up to the position of an advanced beginner, then moves into the era of being a competent surgeon, a proficient surgeon, eventually an expert, and then a master. And you can equate these steps with a residency program so that when one enters the residency program, one starts as a novice, then maybe the second year becomes an advanced beginner, third year begins to be competent, and then from that point on requires a real interest and desire to do endoscopic surgery. Some residencies do this very well, but most still do not. And I think that's been an unfortunate failing of our system because we expect everyone, when they finish a residency program, to go out and do everything. And today that's not possible. And as a result, laparoscopic surgery in practice has not moved ahead in gynecology as it has in, let's say, general surgery, where, if you don't do laparoscopic surgery, you don't get referrals. In our system, which does not depend as much on referrals, one can do abdominal surgery and carry on a successful practice without doing a lot of endoscopic surgery. So I think this is a long way to develop this topic, that we really have to look at new methods for teaching endoscopic surgery, to develop people that are really good, really proficient, that can then take this to every hospital in the country. It doesn't exist at the moment in the U.S.
In your experience, in speaking about United States, obviously that's where we practice, and what is the position of malpractice and endoscopic issues that we face as far as limiting the advancement of young professionals who are eager to do laparoscopic surgery, yet afraid or find true guidance?
I think this This is very true, not only in our country, but it's beginning to be true in all of the industrialized countries where malpractice has actually begun to focus on the development of technology, and people who are not well trained in the technology have put their patients at an increased liability. And I think, at least in the big cities in the United States, the malpractice concern is a great concern for many surgeons, and they avoid procedures such as laparoscopic surgery because they don't have the skills to do it safely and efficiently, and it does change practice patterns.
And my last question is again about training, which we look you one of our teachers all the time and experience in this subject. Do you believe there are enough fellowship program for GI endoscopy in the United States? And to follow up on the same question, do you think ISGE may have some input on developing some fellowship program in the United States or for some of our members even abroad?
There are relatively few fellowship programs in advanced endoscopic surgery. Somewhere between 14 and 18 at the moment that exist in the United States. These programs can only take in a limited number of fellows per year, so that the number of individuals graduating with advanced laparoscopic skills is really, for a country our size, quite small. Whether or not the ISGE has the thought of developing endoscopic training programs elsewhere is a hard question to answer, because the variability of skills around the world is tremendous. In many countries, like the US, the UK, and the countries of Europe, skills are high. In virtually all other countries, though, skills are, for the most part, pretty low. And so that the training that is being directed in the developing countries is really at basic endoscopic surgery, not at advanced endoscopic surgery. There's an enormous difference between the two. The ISGE's focus has been on the training of basic endoscopic surgery, and I think that's probably where it should be.